I mentioned the term engorgement. We're going to talk about engorgement and mastitis. Engorgement occurs 3 to 5 days after birth. This is where mom's milk comes in and she is completely full. It is very discomforting, and she will be instructed to feed every 2 hours, at least to soften one breast, and then may have to pump the other breast in order to relieve engorgement. Some other things she can do is use cold packs after breastfeeding, cold cabbage leaves. Before breastfeeding, she can take an anti-inflammatory medication, do breast massage, and pumping. Then we're going to talk about mastitis, which starts on page 655. Mastitis is the inflammation of the breast. This is common in women who breastfeed. Usually what happens, there's a sudden onset of flu-like symptoms, which will be fever, chills, body aches, headache, and there's usually localized breast pain and tenderness. There's usually a hot reddened area on the breast. It usually occurs in the upper outer quadrant. It can occur in one or both breasts. Usually the reason or what causes it is inadequate emptying of the breast. Treatment includes antibiotics for usually 10 to 14 days. And usually they're encourage mom to rest as much as possible and breastfeed in order to empty her engorged breast or pump frequently. She can use warm compresses to the breast before feeding, and then they also encourage her to increase her fluid intake. Complications of mastitis could include breast abscess, chronic mastitis, and fungal infections. Before we talk about formula feeding, I mentioned the word or the term engorgement. Engorgement is the common response of the breast, and it's due to the sudden changes in the hormones, and it's the increase in the milk volume. It usually occurs 3 to 5 days after birth, and it is a rapid increase. And like I said, mom will have to probably pump. We will encourage her to feed every 2 hours, at least softening one breast and maybe having to pump the other one. Some treatments that can be used for engorgement is ice packs or a cold compress. This is where they can also use the cabbage leaves or give anti-inflammatory or pumping. So for newborns who are going to formula feed, there are a couple of different things we need to go over. First, feeding patterns. Typically in the first 24 to 48 hours of life, the newborn will consume anywhere from 15 to 30 milliliters of formula. We usually don't encourage them to take a lot of formula because their stomachs are really not very big. They're only the size of the pea. And typically what will happen is they still are pretty full of fluid from the delivery, and they're still trying to adjust to that extra uterine life. This will gradually increase during the first week of life. Most newborns will drink anywhere from 90 to 150 milliliters at a feeding by the end of the second week. Formula feeding starts on page 656 in your textbook. Newborns who formula feed should feed every 3 to 4 hours. They will show adequate weight gain, and once they show adequate weight gain, they can be allowed to sleep at night, and then they should have, in order to get adequate feeding, 6 to 8 feedings in a 24-hour period. Feeding techniques for formula-fed babies. They need to be held for all feedings. They encourage the parent to sit comfortably, hold the infant close in a semi-upright position with good head support. They do encourage these babies to use a slow flow nipple for the first few weeks because they're still trying to learn how to coordinate that suck, swallow, breathe mechanism. And when you have a formula-fed baby, if you use a regular nipple, it's pretty steady stream of formula, and they don't quite know how to grasp sucking, swallowing, and breathing all at the same time. One of the things that can be done when bottle feeding is something called paced bottle feeding. This is where the bottle is held at a horizontal angle. The baby will actually pause between bursts of sucking, and when the baby does that, the parent will withdraw the nipple just slightly and resting it on their lips to kind of let them breathe and then resume sucking. We do want to instruct the parents any kind of signs of distress. So signs of distress for a baby who is drinking from a bottle would be turning their head side to side, arching their back. They would be choking, spitting, any change in their color, moving their arms or tensing up their fist. If that occurs, they need to stop the feeding, calm the baby down before they would resume any type of feeding. Most infants will swallow air. This is common, so they do need to be burped several times in between the feedings. When do we need to call the physician? Parents need to be instructed to call the physician if the newborn vomits more than 1/3 of their feeding. We also need to instruct them that they should place any nipples or bottles or cleaning tools in boiling water for 5 minutes. Allow them to air dry, and that should be done at least before the first use. You can do it thereafter in the dishwasher for most products now. They're dishwasher safe. Infant formula. There are different types of infant formula. They start on page 657 in your textbook. There is ready-to-feed formula. This is actually the most expensive. It's already ready to go. You don't have to do any pre-mixing or mixing up. And you can just pour it in the bottle and give to the baby. There's concentrated formula. It's less expensive than the ready-to-feed. It is diluted with equal parts water. It can be stored in the refrigerator for 48 hours after opening. The same goes for the ready-to-feed formula. It is safe to be in the refrigerator for 48 hours. The teaching mechanism and of formula preparation and feeding and storage is important for formula feeding, and storage is also important for breastfeeding, so make sure that you review that in your chapter. There's also powder formula. This is the less expensive. It is easily mixed with 1 scoop of powder for every 60 ml of water. That finishes chapter 24. That really was the highlights for newborn nutrition and feeding. So these are the things that I want you guys to focus on as far as your final goes. If you do have any questions about anything that we went over, make sure you ask me, email me, or review in the chapter.